I remember the day my dad stopped finishing his lunch. It wasn't dramatic, just his plate coming back half full more often. I worried, I asked, and I tried everything from new recipes to gentle walks after meals. What helped most was tiny, a warm, fragrant sip before the main, and a colorful bite that felt easy to chew. That small win, wow, it changed how he ate for days. Today, we'll share clinician-vetted ways to create those small wins for the older people in your life.
When my mother lost her appetite after a hospital stay, I felt lost. One afternoon, I made a little broth and brought it to her in a favorite mug. She smiled, took 2 sips, and then asked for another. That was the first time she'd requested food in a week. It felt like hope.
Welcome back to Earthy Remedy. Natural remedies, real food, better you. I'm Samnong, your host and wellness guide. Today, Appetite Revival, kitchen tactics for older adults that are low burden, safe, and clinically conservative. Fiona?
And I'm Fiona, bringing the nutritional and evidence-based blends. We'll talk with 2 clinicians, Dr. Miguel Alvarez, a geriatrician who helps families decide when to treat versus when to tinker with the kitchen, and Dr. Priya Nair, a speech-language pathologist who reviews swallowing safety and approves every texture demo we share. Production note: because we're on audio, we'll use vivid sensory language and gentle prep sounds so you can imagine aroma and texture. Important medical disclaimer first. What we share are conservative, food-first tactics, not a replacement for a clinical evaluation. If a person is losing weight rapidly, coughing with eating, or having recurrent chest infections, seek medical attention right away.
Thank you, Fiona. Hi, everyone. I'm Miguel. Quick signpost. Appetite in later life changes for lots of reasons: sensory loss, medications, dental issues, mood, and sometimes underlying illness. Our goal today is realistic: improve intake and enjoyment where appropriate, and be crystal clear about red flags that mean a clinician needs to step in. Hello, I'm Priya. I'll guide the safe texture choices and give you a brief on-air swallow screening before we demo any textured foods. We kept every demo conservative: single bite rules, moistureness, and cooling steps. If at any moment you notice coughing, voice change after swallowing, or difficulty managing saliva, stop and consult a clinician.
Okay, outline for listeners. First, we explain why appetite changes with age. Then, a clear list of red flags. Then 3 demos you can try after you download the printable checklist in our show notes. We'll close with a 14-day micro-trial plan and clinician scripts you can hand to your provider. Ready, Fiona?
Ready. Let's start with the basics. What's actually happening when appetite fades?
From a physiological perspective, appetite changes can come from decreased taste and smell sensitivity, which are normal with age. Certain medications, like SSRIs, some blood pressure drugs, and anticholinergics, dental pain or missing teeth, and conditions like depression or early neurodegenerative disease. Metabolism also slows a bit, but importantly, decreased appetite doesn't always mean normal aging. It can signal disease. So the question we ask is, can simple, safe food changes help? Often yes, for mild to moderate appetite loss. But rapid weight loss, more than 5% of body weight in 1 month or 10% in 6 months, needs evaluation.
The research shows that sensory enhancement, stronger aromas, more contrast on the plate, and small, nutrient-dense portions can increase intake. Bioavailability matters too. Small additions of healthy fats or concentrated proteins can make each bite more nourishing without increasing volume too much.
In my experience, the combination of aroma and portion size matters more than fancy recipes. A steaming cup of broth before a meal and a tiny, colorful bite afterward can spark interest. That's where it gets interesting. Low effort, high return.
Exactly. The goal is to restore meaningful intake and enjoyment. But again, if there's frequent coughing during meals, recurrent chest infections, or notable weight loss, that's not just a kitchen problem, that's medical.
Let's be specific about those red flags. Priya, can you list the dysphagia signs caregivers should watch for and also give exact escalation language they can use when contacting a clinician?
Yes, watch for coughing or choking during or right after swallowing, a wet or gurgly voice after eating, nasal regurgitation, unexplained weight loss, frequent clearing of the throat, or taking a very long time to finish a meal. Also look for drooling or difficulty managing saliva. If you see any of these, stop the texture trial and contact a clinician. A concise phrase to use with your provider: my loved one has started coughing with liquids and soft foods and lost 6% of their weight in the past month. We need a swallowing assessment. That gives the clinician key facts immediately.
That phrasing is gold. We'll include that in the show notes as a copy and paste script for texts or emails.
Before we do food demos, here's an on-air swallow screening checklist you must run. If any line is no, pause and call a clinician before proceeding. 1. Can the person sit upright without support? 2. Are they alert and able to follow a one-step command, like lift your finger? 3. Do they have stable breathing and no recent episodes of aspiration pneumonia? 4. Do they have a strong voluntary cough? If any answer raises concern, stop. We'll also recommend using a spoon instead of a straw for initial trials, and small plates to manage portion size.
Make sure to download the printable checklist in our show notes and run this checklist before you try any texture demos. Okay, demo time. Samnang, you'll lead Demo A, Aroma Priming Sipping Broth. Priya, you'll do the SLP preface and safe sipping instructions right before the recipe.
Only proceed if the on-air checklist items are all yes. For liquids, we'll use cooled, warm, not hot, broth, served in a small mug. Use a teaspoon sip, pause between sips, and watch for coughing, throat clearing, or a wet voice. Stop immediately if any of those happen.
Demo A, Aroma Priming Sipping Broth. This is a single-serve, highly aromatic broth meant to prime appetite in the 5 to 10 minutes before a meal. Ingredients first. I'll read them slowly so you can jot them down. Ingredient list: 1 cup water, 1 teaspoon low-sodium chicken or vegetable bouillon, or 1 strong herbal tea bag for vegetarian option, 1 small slice of fresh ginger, about a thumbnail size, lightly crushed, half a strip of lemon peel, no pith, for bright aroma, and a pinch of savory herb like thyme or parsley. Optional, 1/2 teaspoon of olive oil for mouthfeel.
Nutritionally speaking, this little cup is mostly about sensory stimulation and a bit of sodium to trigger taste receptors. If sodium is a concern, use a concentrated herbal tea like rosemary or a lemon ginger tea bag instead.
Step by step, slow and numbered. Step 1. Pour 1 cup of water into a small pot. Step 2. Add the crushed ginger and lemon peel as the water warms. You'll begin to smell the oils. This is the primer. Step 3. When it reaches a gentle simmer, lower heat and steep for 2 to 3 minutes. Step 4. Remove from heat. Add the bouillon or tea bag and let it sit for 1 minute. Step 5. Strain into a small mug. Let it cool so it's warm to the lips, not hot. Step 6. Offer a teaspoon sip and wait 30 seconds. If no coughing or change in voice, offer another small sip. Aim for 3 to 4 teaspoons total over 5 minutes.
A couple of SLP safety tips for this broth. Keep it warm, not hot. Avoid straws for initial trials, and keep the volume small. Teaspoon tips are intentionally tiny so the person can manage the liquid safely. If the person has asthma or strong scent sensitivity, use a lower aroma version. Remove the lemon peel and use a mild tea bag instead.
Sensory note. When you lift the mug, describe the aroma aloud to invite attention. Smells bright and lemony, because naming it can help shift attention towards tasting. That little invitation can be surprisingly persuasive.
If you're doing this for someone on a sodium-restricted diet, use the herbal tea option. If allergies to ginger or citrus exist, skip those and use a mild herb like rosemary or a single chamomile bag to gently stimulate appetite without triggering reactions.
Demo B is our textured nutrient small bite platter. This is for people who can manage soft solids but may have chewing or denture limits. We'll list single bite items that are nutrient dense and easy to eat. Ingredients. Read slowly. 1. Soft scrambled egg, mashed with a little olive oil. 2.
Small spoonful of canned salmon, flaked and mixed with a teaspoon of mashed avocado. 3. Half a very ripe banana, sliced into coin-sized pieces. 4. A tablespoon of full-fat Greek yogurt, mixed with a mild fruit puree. 5. Soft polenta spooned into small rounds. 6. Steamed, well-mashed carrots with a dot of butter. Each piece should be about bite-sized. Think 1 teaspoon to 1 tablespoon each.
A quick note on portion math. Aim for concentrated calories and protein in each mini bite so that 3 to 6 bites deliver meaningful nutrition. Example, a tablespoon of canned salmon mixed with avocado can provide 5 to 7 grams of protein in 1 bite. That's efficiency.
SLP caution for small bite platters. Make sure each item is soft, moist, and easily mashed with the tongue against the palate. The single bite rule matters. Never offer larger pieces. If dentures are loose, try soft pureed textures instead. Always start with a spoon or fork rather than finger foods, and observe for coughing or throat clearing after each bite. Stop if you see any trouble.
Practical plating tip. Use vivid color. An orange carrot puree next to a green avocado spoon and a pale salmon bit. The contrast invites the eye, and for many people, the eye invites the mouth. That's simplicity. Color plus small, manageable portions.
And substitutions. If protein like canned salmon isn't available, use mashed lentils or mashed soft tofu with a drizzle of sesame oil for flavor and fat. If dentition or dysphagia is a concern, puree to a smooth consistency and use the broth as a sipping primer beforehand.
Demo C. Color and gentle crunch plate. The idea is to balance warmth, temperature contrast, and a tiny, safe crunch to invite tasting. Ingredients. 1. A warm base, like mashed sweet potato cooled to warm. 2. A soft protein, shredded chicken or mashed chickpeas. 3. A very small sprinkle of toasted puffed rice or toasted millet for a gentle crunch, no hard nuts. 4. A bright herb garnish like cilantro or finely chopped parsley. 5. A squeeze of lemon or a dot of flavored oil. Keep the crunchy element in microscopic amounts. Think crumble, not stick.
Priya here again. For anyone with suspected swallow problems, skip the crunchy element. Offer a soft textural contrast instead, like a slightly thickened sauce or a silkier puree. If you try the crunch, make sure it dissolves easily and is less than a fingertip amount on each bite. Always watch for coughs or voice change after that bite.
Nutritionally speaking, small amounts of healthy fat, olive oil, a bit of tahini, or a fine drizzle of nut butter can make a bite more satisfying and calorically dense without increasing volume. That can be particularly helpful when appetite is low.
Sensory moment. If you make the color and gentle crunch plate with someone, invite them to hold the plate and notice the warmth and the colors before taking a tiny bite. Say, look at this bright orange next to green. Doesn't it look like sunshine? That gentle invitation is part of the ritual. This is where it gets interesting.
Okay, once you've tried one of these interventions, here's how to run a 14-day micro trial and gather usable data for your clinician. First, single change rules. Only change one variable at a time for 3 to 5 days. Example, just the sipping broth before meals for days 1 to 4. Measure simple daily metrics. 1. Meal acceptance. Did they eat all, some, or none of a selected meal? 2. Enjoyment on a 1 to 5 scale. 3. Number of small bites or sips. And 4. Weight trend. We suggest weighing once a week under consistent conditions. Record anything unexpected, like coughing episodes or digestive upset.
We designed a printable tracker in the show notes with these exact metrics so you can bring clean, clinician-ready data. Keep notes simple. Morning weight, after lunch acceptance, any coughs during or after meals, and a one-line note about mood or energy.
When you bring data to a clinician, be precise. Use language like, over 2 weeks, we trialed a lemon ginger sipping broth before lunch. Meal acceptance went from 30% to 70% for lunch. Enjoyment rose from 2 to 4 on your scale. Weight is stable, and there were 0 coughing episodes. If you do see concerning signs, again, use the escalation language Priya shared.
Medication interactions. The classes most often affecting appetite are certain antidepressants, some antihypertensives, anticholinergics, and some anti-Parkinsonian drugs. The evidence suggests checking if dose adjustments or alternative agents are possible with the prescriber. Don't stop medications on your own. If a medication is likely causing poor appetite, ask the clinician, could this med be contributing to decreased appetite and weight loss? And are there safer alternatives or dose adjustments we could try?
A legal and medical note. The tactics we describe are low risk, but they are not appropriate for everyone. If someone is on blood thinners, has uncontrolled diabetes, or has advanced cognitive impairment with feeding safety issues, coordinate with their healthcare team before trying new textures or concentrated calorie strategies. We emphasize collaboration, not DIY fixes.
Before we close, a few production notes about how we conveyed aroma and texture on audio. We used descriptive language, warm lemony steam, silky mashed sweet potato, and short prep sounds in the production mix so listeners following along could have a sensory anchor. But remember, these descriptions are supplements. The show notes have step photos and a printable microtrial tracker so you can see what we're describing and move forward safely.
I ran the 14-day broth microtrial for my mom. We followed the checklist first. By day 5, she asked if I could make it again. Seeing her ask for it, that tiny change, made me feel like we were doing something right.
That story captures the goal: restore appetite and connection with low burden. The bottom line is, start small, track carefully, and escalate when needed. And please, use the scripts in the show notes when you call a clinician. They'll thank you for clear, actionable data.
Thank you to Dr. Miguel Alvarez and Dr. Priya Nair for their clinical wisdom, and to Marta for sharing a caregiving moment we can all learn from. Before we go, remember the SLP checklist in the show notes. If you try any of these microtrials, tag @EarthyRemedy with a short note or send us a 15 to 60-second voice message describing the change. We want to hear what worked, how you adapted it, and any unexpected things you learned.
And download the printable tracker and clinician scripts from our show notes before you begin. If you prefer low bandwidth, you can email results to the address in the notes instead of tagging. These resources include exact clinician wording and photos of each demo, so you can try them safely.
If in doubt, stop and seek assessment. Safety first, then creativity. Small, sensory-rich steps can make mealtimes more meaningful, but don't push textures if you see signs of swallowing difficulty. One last clinical pointer. When you bring the tracker to a clinic visit, highlight weight trend and any instances of coughing or aspiration. That directs evaluation and testing efficiently and helps the clinician decide whether a swallow study, medication review, or nutritional support is the right next step.
All right, this is the remedy. Low effort, clinician-vetted tactics, and clear safety steps. Try one microtrial, track it, and share the results with your care team. You've got this.
Thanks for listening. From a nutrition standpoint, small concentrated bites and aroma priming can move the needle. Be kind to yourself as you try adjustments. This is care work, and it matters.
This episode's signature cue: listen to your body. Trust the earth. Feel the difference. We'll be back with more practical, nature-forward ways to support everyday wellness. Take care of each other.